Hello, this is Demo 1 for the long thoracic nerve pathway and risks for upward rotation dysfunctions of the scapulothoracic joint by Kate Neve, Bailey Dennis, Cassie Baumann, and Cindy Petros.
Does this illustration look familiar to you? Because it should. This is a model of the brachial plexus, and you can see how the long thoracic nerve branches from the roots of C5, C6, and C7. This graphic shows the pathway of the long thoracic nerve in the human body. The long thoracic nerve originates at the C5, C6, and C7 roots of the brachial plexus. The long thoracic nerve then passes posterior to the brachial plexus and the axillary artery. The roots of C5 and C6 pass through the scalenus medius and then meet up with the root of C7. Next, the long thoracic nerve vertically passes down the serratus anterior muscle in order to innervate it. As you can see here, the long thoracic nerve passes underneath the clavicle and extends from the 1st to the 9th rib. The picture shows how the long thoracic nerve runs deep to the pectoralis minor.
The serratus anterior muscle allows for protraction, upward rotation, and depression of the scapula, as well as holding the medial border of the scapula against the rib cage. The following movement shows the protraction of the scapula. And here's what the scapula look like during protraction. This action can be useful for activities such as reaching for objects and rowing a boat. The next movement shows upward rotation of the scapula. And here's what the scapula look like during upward rotation. Upward rotation can help you perform activities such as reaching for an apple, screwing on a light bulb. The next movement is depression of the scapula. Then this is what the scapula would look like during depression. This action is useful during shrugging the shoulders. You see elevation and depression. The serratus anterior also holds the medial border of the scapula against the rib cage. You can see in the picture exactly where it inserts along the medial border of the scapula.
Damage or injury to the long thoracic nerve will cause weakness or paralysis in the serratus anterior muscle, resulting in winging of the scapula. As you can see in the next video, winging of the scapula is when the medial border of the scapula releases from the ribs. This causes a dysfunction of the scapulothoracic joint and restricts actions of the serratus anterior muscle. Injury to the long thoracic nerve can be caused by neuralgic amyotrophy, external compression or stretch, or traumatic injuries related to sports or car accidents. Neuralgic amyotrophy is a disorder of the peripheral nervous system which results in extreme pain and weakness in the upper extremity. Overstretching of the long thoracic nerve is most commonly seen in athletes excessively doing overhead motions, such as tennis or archery. Other sports such as football and wrestling, the long thoracic nerve is most likely damaged by a traumatic collision.